why don't we talk a little bit about work with children and adolescents, and tell me some about that, how you got into it and what you're doing in that area.
Yeah. Well, that's something really new for us. The study that we've been doing has been focusing on adults. But one of the things we're trying to do is to expand it. In addition to this main clinical trial, we've got a lot of other projects that are going on, which are related to this, all of which relate to schema therapy in one way or another, including other clinical trials on a smaller scale, as well as fundamental studies that look at emotion in psychopaths and so forth. So we've got a whole program of research going on here. And of course, one of the things that would be really nice would be if we could find a way to use schema therapy to help adolescents who have what you might call personality disorders in development. It's kind of hard to pin down, in an adolescent, whether an adolescent actually has a personality disorder or not. If you try to apply the DSM-4 criteria, what you see is that probably if you just do that without really looking at how persistent these problems are, what you see is that a very large percentage of adolescents, even in a normal population, will qualify as having a personality disorder.
Yeah.
So and there's been research that some of which I've been involved in, and other people that shows this. So, we don't want to pathologize what is actually just the normal Sturm und Drang of adolescence.
Right. Yeah.
But nevertheless, you also have adolescents who have really gotten themselves into severe problems, and where the problems in question are not ones that are just going to resolve themselves by virtue of growing out of it. And so what we're doing now is a pilot study, and we're trying to so far it's very small. We're working with a institution, the OGH Stichting in the Netherlands, that's also an affiliate, or actually a part of the Royce Wissel, this forensic hospital I mentioned earlier. And what we're doing is a schema therapy for adolescents who have externalizing behavior problems and, quote, personality disorders in development. So where we think that these are people who, if we aren't able to treat them, these are people who have already ended up in a residential placement by virtue of behavior problems. So these are kids who are really having some pretty serious problems. And so we want to see, is it possible to intervene at a point where personality is still malleable enough that maybe by delivering an intervention at an earlier age, we could prevent these people from going on to be like these forensic patients that I was just talking about. Is it possible that we could actually nip it in the bud, in a sense?
Yeah. Right.
That's what the project is about.
Yeah, interesting. And in working with the adolescents, and you're looking at modes again, and the process of limited reparenting, I assume. And
yes.
And are there major adaptations? Because I know that with adolescents, the developmental thrust is away from attachment with adults and more towards peers. And are there things like that you're having to deal with around the process of connecting with the vulnerable side and forming an attachment with this population?
Yeah, that's really, really a good point. Well, this is just a pilot study we're doing right now. So we're just starting out with 4 patients. And so these are the kinds of questions that we're looking at. We're looking at are the kind of question that you just asked that really have to do with, to what extent do developmental issues play a role in the way that you might have to change the way in which you deliver schema therapy. And another issue, of course, has to do with the role of the family and how do you take that into account. So, but in terms of, and of course, there also are some cognitive differences between adolescents and adults. So, all of these are things that you have to take into account. We have some ideas about it, but we're hoping to see, by virtue of what we learn in actually doing the treatment with these 4 adolescents, we do have a kind of a protocol we've developed, but we're trying to go and adapt it then based on the experiences we're having. Now, having said that, what we see with these adolescents so far is that some of them seem to make an attachment very quickly, even more quickly than you would expect in an adult patient without a very severe personality disorder. And if you think about it, it kind of makes sense with some of these attachments, with some of these adolescents. you know, it's just like they're starved for attachment.
Mm-hmm.
They're so primed to want to attach,
Mm-hmm.
and yet in many cases, unfortunately, due to circumstances, they haven't had the opportunity.
Mm-hmm.
You could almost say that their attachment style is a little indiscriminate.
Uh-huh.
You know, it's like any warm body will do, you know.
Mm-hmm.
So that's one type.
Mm-hmm.
Another type, what you see is very much the opposite. And another type, you see something that looks much closer to what I just described with the forensic patients, where they tend to seem quite mistrustful and keep their distance.
Mm-hmm.
And so what we're doing is we're using the schema mode model, and we're trying to approach it in a way that's quite similar to what we do with the adult forensic patients that I was describing.
Mm-hmm.
And so what I can tell you, when it's still quite early in the study, so I don't, you know, these are good questions. I don't have a whole lot of answers for you yet. We're going to be talking in the workshop about this process, what we're starting to learn.
Mm-hmm.
But I can only, because I'm also a researcher, you know, I'm trying to stick closer to the data and what we actually know already.
Mm-hmm.
What I can tell you is that the schema mode model seems to fit very well.
Mm-hmm.
That, you know, it really appears that you can, that you can identify the modes quite readily in these adolescents, and that you can also help them to recognize the modes quite readily.
Mm-hmm.
And that it's a language that seems to appeal to them, that makes sense to them, or that they can connect to.
Mm-hmm.
And also that the reparenting, again, seems to be key. I mean, we're also using experiential techniques and so forth, and that's also important, of course. But, you know, the key, again, is the attachment relationship with the therapist. That really, and we're very lucky in the sense that we have an excellent therapist, Tineke van der Linden, who's delivering the therapy, who's a very, you know, lovely, warm person, and is the kind of person who also, you know, just has the ability to relate to adolescents, and they have an ability to relate to her.
Mm-hmm.
And that helps a lot too, of course.
Yeah.
Having somebody who has that quality to really deliver the reparenting in the kind of way that they need.